There are many causes of toothache. I mean, the most common one being actually a cavity. It could be one that's left for a long time and now it's not technically, I mean, there is a cavity there, there's, decay, but it's not just like a filling at that point. It's, you need root canal. Sometimes, a tooth breaks, and that causes toothache. There might be no cavity at all, might be no decay at all. Decay is really when we have, a part of the tooth that's kind of decomposes and destroyed by the bacteria. That's what we call a decay. But it could be that the tooth just fractured because somebody, bit on a popcorn kernel by mistake, and just kind of broke the tooth in half. It could be nothing. It could be that somebody bit down on something particularly hard in the wrong way, and it irritated the nerve, or kind of put a strain on the jaw muscles and the TMJ, and that's kind of what we call bruised or irritated, and that's just gonna go away over time. Sometimes people have sinusitis, they have sinus infection, especially the top teeth. They're coming and they're like, oh, my top teeth are hurting, I think I need all of them taken out, or like I need root canal in every tooth. And you're like, well, did you have a cold recently? So it's that could cause toothache, but it's not really. Trauma can cause toothache. Sometimes we need to do something about it, sometimes we don't need to do anything about it. It's just, again, a bruise, a trauma that needs to kind of heal on its own. 99 times out of 100 you want to come in to get checked out. Is it an emergency that requires the patient to come in right away? Not necessarily. I mean, it's always great to, if there is toothache, to kind of address it as soon as possible. Sometimes it's better to deal with, mild toothache that might be, fixed by a small filling, than to wait and come in, when it's really bad and excruciating, wakes you up at night, and it's become a root canal now. So, every case is different.